Appreciate it. Joining us now from Gainesville, Florida, is Representative Ted Yoho, Republican from Florida and a fierce critic of Obamacare. Congressman, can you hear us? Welcome to New Day.
Yeah, I can.
All right.
I can hear you fine, Chris.
Great. So let's talk about the playbook. I grew up reading these, and it's a good one. Let me ask you, is it a fair criticism that it seems to be missing a section called solutions?
No, not at all. We've got two great solutions for a replacement. It's H.R. 2300, a bill presented by Tom Price out of Georgia, and then there's one out of the Republican Study Committee, H.R. 3121. And the good thing about these is they put health care back where it should be, between the patient and the doctor, and keeps the government out of it.
And how will that work to protect people from all the problems that we see in the current health care system?
Well, the big thing is, like I said, to keep the government out of it. The government's taken a free enterprise system, that our country is founded on. It's like if you wanted a car, you buy a Ford, Chevy, whatever car you want, you buy the model that's going to fit your needs. That's what we did with our health system. That's what we've done with so many things, but the government's come along and says, well, we're going to make it like a public transportation model system. The H.R. 2300 or H.R. 3121, they keep health care in the hands of the individual. They have tort reform in there. They cover for pre-existing conditions. They allow adult children to stay on their parents' policies until age 26. They promote, and I think this is a critical thing, they promote health savings account, so people have the money put aside for specific health reason costs. And this is what we should be promoting as government, is independence, self-reliance, and things like that. And this allows for that.
The criticism, of course.
And it also allows for
Go ahead, Congressman. Go ahead. No, please. This is about what you have to say. Tell me.
Well, it also allows it also allows for interstate commerce between states on insurance, so that they can, shop around and get a better price for it.
Now, obviously, you'd have to deal with the 10th Amendment rights, and each state has its own laws, and that gets a little tricky when you make policies portable. But it's a solid idea. The criticism that comes from the other side is the system as it is has real flaws, and anybody who's dealt with the system knows that. Consumer protection is important, the uninsured getting policies is important, and that the insurers had really overtaken the system through the marketplace. Are you worried about not protecting people by just saying, well, let's just go back to open markets and the private sector will take care of it all?
No, not at all. I mean, look at where we're at, and this is why the Republicans were so adamant about not allowing this law. I mean, this is just the beginning of it. This is the tip of the iceberg, and you're talking about consumer protections. Look at what the government's allowing happen. They're allowing people to sign up other people and getting critical information, their driver's license number, Social Security numbers, and the navigators, the people signing people up on the exchanges, they're not bonded, they're not insured, they're not trained in insurance, and you know how complicated insurance it can be to meet a need for your family, and the government allowed this to happen, and there's been breaches in the security of this. So you talk about consumer protection. I agree, that's a very important thing. And when you have somebody like the Consumer Reports coming out stating don't sign up on the government website, it's set up for fraud. So that's a big concern, and we'll get away from that if we go back to the private market.
So, I'm hearing these ideas from you about these legislative proposals that would be an alternative to the ACA, but they're not in the playbook. Shouldn't those be like what's foremost in terms of capturing the imagination of the American people? We need answers, not just criticism of what is in place now. Why not push those plans more than just the attacks in the playbook?
No, I agree 100%. I agree 100%. We don't need to criticize. Criticism at this point is not going to help anybody. We need solutions. We've got two great solutions out there. We talk about it all the time. I do. I know a lot of other congressmen. I would encourage you to talk to Steve Scalise, who's the chairman or the chair for the Republican Study Committee, and he can tell you about H.R. 3121. And Tom Price out of Georgia, his bill is H.R. 2300. These are great replacements, and they've been out there. We've been talking about it, but the news has not been picking them up. And so I encourage you guys to, do your due diligence and get that out there more. Thank you.
Well, fair criticism, Congressman, though, that when I'm holding the playbook in my hand, that's some 18 pages of all attacks on Obamacare, and very rarely have I heard about these other two bills, that it's really not just the media, it's what politicians are deciding to make their message. Fair criticism?
I think that's fair. We could do a better job on messaging for sure. I know I have in our district. Every time we're in the district, every time we take a meeting with the business people, and you know, I ran on stopping the Affordable Care Act because we saw the disaster. And like I said, this is just the tip of the iceberg. Think about where we're going to be 3 months from now. All these people that are registering thinking they're going to have coverage, or they've got a number. They thought they got on the website, they've got a number. They go to the hospital, maybe their son or daughter's fallen and broken an arm or something like that. The receptionist at the medical care facility types in their number, and they come back and say, listen, you're not in the system. We can't treat you. You can see the chaos that's going to create. And so they're obligated to that child. And so they're going to take some information, and after they treat the child, they're going to put that information somewhere to get paid. We know how it works. If you put in a Medicare payment wrong or a Medicare treatment wrong, that doctor or that facility has a possibility of being charged for fraud. This is going to happen. And then the other thing that I really fear for is the people that had insurance through their own that got canceled and haven't been able to sign up on the Affordable Care Act. They're in limbo because they can't get on. They've lost their insurance because of the government plan and mandates. And this is, again, why the Republicans fought so hard to prevent the rollout. Well, you know, we wanted to get rid of it. We all know that. We fought hard to get it defunded and repeal it. But at the end, we just fought to get it delayed for a year for the individuals because we saw this disaster. And when Max Baucus, who is the primary architect of this, said it's a train wreck, stop it.
Well,
and they didn't heed that warning. I think that's unconscionable. Yes, sir.
I'm saying I hear the points. They're good ones. And certainly if the predictions come true, there's going to be plenty of opportunity to do it better. And we'll be looking forward to the answers that come from the GOP and the Democrats. Appreciate you coming on today, Representative Yoho. Appreciate the opportunity.
Yes, sir. Thank you. Have a happy Thanksgiving.
And you as well, to you and yours. Indra, over to you.
Definitely still talking about snow this morning.